Many times hospitals get maligned because they give the appearance that they're not interested in helping the communities that they serve. The reality is they're trying the best they can, especially in a community like East Los Angeles, where there are so many people uninsured, as Dr. Brown mentioned. And what they struggle with is just to keep themselves above water, because the resources they get are not as lucrative as if they had located their hospital somewhere else. And the challenge then becomes is they don't even have time to come up for air. And this is really where the leadership of senators like Senator Cedillo and Supervisor Molina is that they're creating strategic plans and strategic partnerships with these safety net hospitals to be able to improve access to your question, public health, and the government's role in that. And we all talk about economic engines in underserved areas. Healthcare is an economic engine. It's an opportunity for growth. We've seen in our own practice the 155 employees that we employ are now families that have meaningful employment and a lifestyle that they never thought they could have. And secondly, by the multiplier effect, each job we create creates 20 jobs somewhere else, because we also have vendor services with local vendors. Our first priority, and the hospital's first priority, is to offer local businesses a chance to get their business. It's a tremendous formula where everyone wins. Lastly is that part of the governmental role in improving health is not only as an economic engine, not only as providing those services, but reorganizing the delivery of care. I'm a primary care physician. I could not do the work that I do for my patients without specialists, without hospitals, but I also see the critical shortage of primary care. And part of what the government can do is reorganize that care. And both the House bill as well as the Senate bill are proposing not only universal access, where everyone can access these community clinics and safety net providers, empower private doctors like us in our practice to do more at their fair share of caring for the poor, but also to empower the hospitals to do that. Secondly is to provide the resources so that they can plan strategically and survive. Because that's the other thing about healthcare, is that we have to operate it as a business, because if we don't pay the bills, we can't keep the doors open for the people we want to serve. So we need to be able to have the resources to accomplish that.